So I'm Mark Rickenbach, as you've heard. I'm a GP, and I'm also visiting professor of healthcare at Winchester University. And I have a research interest. I've worked with Wessex Clinical Research Network, and an education interest because I've been an associate dean with Health Education England in the past. And I'm going to talk today about the history of the surgery a bit about starting out as a general practitioner, something about the innovations that the patient participation group and the surgery have been involved with, something about what it was like back in 1990 and what it's like now and comparing it, and a little bit about the COVID, of course. So next slide. You'll see here a map. And this map shows Park Road, and there's a big red arrow, and that is the original Park Surgery. And Park Surgery was then known as Radthorne. The name's changed, but the house is still there. And I have been there, and I'm going to show you some pictures of what it might look like. Not exactly. And you can also see the new building to the left with the red marker on, so where Park Surgery is now, on the junction of Hursley Road and Southerns Way. On the next slide, you will see that there is a house very similar to the one there. Now, obviously, I haven't taken a picture of the exact house, but it's a Victorian house, and it was 1897 when Dr Edward Duiguid Ritchie established the practice. So it's more than 100 years ago now. And he set up the practice as a single-handed practice until he died in 1912. And in his memorial, his wife set up the Ritchie Hall and the Ritchie Memorial that you may well know. And when we look at the next space on the slide, we will see the Nissen hut, which has been put up on the site, and that was done in 1940. And this was a temporary residence. And the surgery was run in there, and patients told me about this I've seen over the years, and they told me about how they used to queue under the blossom of the apple tree to see what was then Dr. Sibley. And the doctors between then and Dr. Sibley, there was Dr. Livingstone and Dr. Misquith, and Dr. Sibley, and some of these doctors you may know or hear about or be familiar with, and I'll be interested to know your memories as we come to the end of the talk. You can see Park Road there. On the left-hand side is the hedge, and this hedge is still there, and it's behind there that the original Park Surgery was. So next slide. And you'll see on the right at the top, the doorbell. This must have been fairly original, but obviously it's an electric doorbell, I think. And it says on there, day at the top and night at the bottom, because of course he was on call 24 hours a day, just him. And in the daytime, they'd ring and it'd be the downstairs room, and at night time, they'd ring and it'd be the upstairs in the bedroom that would call. And I can imagine him going out, probably with horse, with no antibiotics, with no active treatments that we knew about there, to look at his patients and share their difficulties with them and hopefully move them forward. And you can see here the original Ford of Chandler's Ford, according to this picture, which was at the end of Hursley Road, just before Park Road. And you can see the flooding that occurred 1 year. So next slide. And then we had Dr. Watson, Dr. Tony Watson, who I'm nodding of heads shows that you remember him, in 1961, who moved into that original house. And he took on board Dr. Reggie Taylor, who you may also know, in 1966. And together they opened the first purpose-built building of Park Surgery. It was built on a slightly marshy pond area, and there is still a pond in the centre, which I have great pleasure in looking at. It keeps me going when I'm there. It housed at least 4 consulting rooms, and we have expanded it inside now. Next slide.